Well, my name is Dr.Maggio. I'm one of the faculty in the Trauma Burn Unit at the University of Michigan. A little bit about myself and how we spend most of the day here. We usually begin the day by performing rounds. This is the one of the units. This is the Trauma Burn Intensive Care Unit just beyond this, and this is a step-down unit where we care for most of our patients. Rounding in the morning, we usually go by and see each patient and evaluate their injuries or burns, and then throughout the rest of the day, we usually spend much of our time in the operating rooms where we perform whatever is necessary for managing those burn patients. In the afternoons, we come back and we simply will round again on those same patients. Generally, morning rounds consist of a team of our surgeons. Most of us are surgeons on this service, so you have about 7 or 8 faculty in the surgical service. In addition, there's several nurses. There's the nutritional staff that's also involved, as well as physician assistants and several house officers, or the surgical residents, surgeons in training, more or less. On those rounds, we normally will take down all the dressings on all the burn patients, evaluate those wounds, and really plan the rest of the week or how those wounds are going to be managed. So initially, early on in the treatment, it may require surgery, so we spend a good portion of our day in the operating room managing most of the patients that spend time in our service and in the unit. And the other component of that is actually setting up long-term treatments as well. So other people that are involved would be the physical therapist, occupational therapist, the rehabilitation services, which would be planning more of the chronic or long-term care. The other component of that long-term care would be follow-up as an outpatient. So even once you leave the University of Michigan hospital, you're still seen as an outpatient, often by the physical therapy services, the occupational therapy services, as well as in our clinic, where we'll continue to follow those injuries and manage them. Often burn injuries are long-term, so there's several components to that require a multidisciplinary approach with all those different services.